Hello, friends. Welcome to Living with Diabetes. I'm gonna discuss about conditions and symptoms. Okay. Every condition, every health conditions comes with symptoms. Though some of the symptoms might be silent, that you might not be able to notice it at the early stage, or you might be able to notice them at the end stage. And that is why it is advisable to always know what is going on around your body. Once you notice any symptoms, any changes in your health, in your body, try to find out, understand what are those symptoms, and try as much as you can to see if you can interpret those symptoms. And if those symptoms keep coming up for up to 7 days, it is advisable to now see a doctor, see your family doctor, and then discuss the symptoms with the doctor. Then test will be run to find out or evaluate or the doctor is going to evaluate your situation and know what tests to do to find out why those symptoms are occurring. So it is advisable medically, once the symptoms last 7 days, then stop self-medication and then see your doctor. All right, see your doctor. Now, I'm going to show you guys symptoms, and then you take it from there. Now, let me show you guys about, uh, share with you guys about these symptoms. Okay, I'm going to share with you guys these symptoms, and then you take it from there. Okay, let me go to. Um, no, let me go to. I'm gonna share this. Okay, so we know about this. Uh, this is courtesy of Cleveland Clinic. All right, so this is a symptom of low blood pressure. Okay, this is a symptom of low blood pressure. Okay, so the first symptoms of when you're having a low blood pressure, you're going to experience dizziness or lightheadedness, or fainting, or passing out, stomach upset, blood or distorted vision, fast or shallow breathing, fatigue or weakness, feeling tired, confusion or agitation. Okay, so this is the symptom of low blood pressure. And I've told you guys in my previous video what is low blood pressure. It is when your blood is below 90 stroke 60 millimeter of mercury, which is mm stroke Hg. Okay, so when your blood pressure is at or below 90 stroke 60 millimeter of mercury, then know you have a low blood pressure. Normally, your blood pressure is supposed to be around 120 stroke 80 millimeter of mercury. All right, so you have to understand when your blood pressure, your low blood pressure dip. If you notice these symptoms, then try to see your doctor. It is not advisable to allow your blood pressure to drop so down so that it doesn't send you into shock, especially if you're diabetic. Make sure once you notice these symptoms, and then it lasted or it keep reoccurring all the time. When it disappears and reappear again, okay, if it keep reappearing and it lasted for 7 days, any symptoms or any ailment that keep going and coming back and it lasted for 7 days, stop self-medication and then see your family doctor and then discuss the situation with your doctor. All right. So I'm just going to share the symptoms of certain conditions so that you should look at, be aware of those symptoms and then guard yourself against those ailments. Okay. So that is what I'm going to be sharing with you. Okay. Now let me go to the next let me go to the next. So let's go to the next symptom. I'm going to share the next symptom with you guys. Uh, let's go to this one, which is this is symptoms of diabetes. Okay, courtesy of Cleveland Clinic. Increased test, slow healing cord and source. You are getting fatigue, blur vision, frequent urination, unexplained weight loss. Okay, so uh, this is the symptoms of diabetes, and we all know what diabetes is all about. We all know about the causes, and then since those that have been watching my video, I believe by now you guys should have learned certain things, how to handle your situations when you experience either hypoglycemia or hyperglycemia, when your sugar level drop or goes high. So you should be able to know what to do next in order to take control of your situation. So this is the symptoms of diabetes. Okay, this is the symptoms of diabetes. All right, so I'm going to go to the next ailment. Okay, I'm going to go to the next one. Okay, so let's try the next one. Next element is this is hypoglycemia. You guys know, courtesy of Cleveland Clinic. So this is the symptoms of hypoglycemia. Okay, you guys know what is hypoglycemia. Okay, you guys know what is hypoglycemia. Hypoglycemia is low blood sugar. Hypo means low, hyper means high. So these are the symptoms of low blood sugar. When your sugar is below the normal level, these are the symptoms that you are going to see. When your blood sugar level drop below the normal level, these are the symptoms. Shaking or trembling, faster heart rate, extreme hunger, sweating, confusion, difficulty concentrating, and then dizziness is the symptoms of hypoglycemia is the same thing as low blood sugar. Symptoms of low blood sugar. Another medical word for it is called hypoglycemia. Hypoglycemia is when the sugar level is below the normal line. Okay, so let me go to the next condition and the symptoms. Okay, let's go to the next condition and symptoms. All right, so now I'm going to talk about this. So this is symptoms of hypoxemia. We all know what hypoxemia is. Can somebody tell me what hypoxemia is? Symptoms of hypoxemia. I've said this several times with you guys. I've said it several times with you guys. What is hypoxemia? I'm going to answer this question. Just hold on a little bit, please. We all know what is hypoxemia. I've said it before. Symptoms of hypoxemia is headache. Okay? If you are having headache, shortness of breath, and I've told you guys the danger when you experience shortness of breath. Anytime, anywhere, whatever you are doing, either you are at home, in the school, in the bus, whatever you are doing, and you are having shortness of breath, do me a favor, report yourself to the nearest clinic or hospital for an emergency attention. When you are losing breath, when your oxygen is dropping, make sure you check in while you are losing oxygen. It is very, very critical so that it doesn't cause more damages to your brain. When oxygen cannot get to your brain, or when your brain is not getting enough oxygen to function properly, it could be catastrophic to your entire heart. So hypoxemia is when the level of oxygen in your blood, okay, is low. Hypoxemia is when you have low oxygen in your blood. And remember, oxygen is transported through the blood to your brain. Okay? So it causes symptoms like headache, difficulty breathing, rapid heart rate, and bluish skin. Many heart and lung conditions put you at risk of hypoxemia. It can also happen at high altitude. Hypoxemia can be life-threatening. When you are having low level of oxygen in your blood, it could be life-threatening, and that is why I've said it several times that when you are experiencing shortness of breath, report yourself, leave whatever you are doing, and report yourself to the nearest hospital for an emergency, because that could be life-threatening when your brain is not getting enough oxygen. Okay, so now so when you are having these symptoms of hypoxemia, please check into yourself to the nearest hospital. Okay, can you recover from hypoxemia? Treatment can help people who have brain injuries from cerebral hypoxemia, but no one can bring back dead brain cells or reverse a brain injury. So in order to avoid a brain injury, okay, or a dead brain cells, that is because it's as a result when oxygen is not getting to your brain. So when when the cells in the brain are damaged or you have a brain injury, it is very, very difficult to be reversed. Okay, and that is why anytime you are experiencing shortness of breath, you can't breathe properly, just go to the nearest hospital to be checked out so that it don't cause you a severe life-threatening injury to your brain. Okay, the condition can result in lifelong brain damage. If it continues too long, it can be fatal. If not enough oxygen, for no reason oxygen is not getting to your brain, it could be fatal. And that fatal could be potent, that might cost you your life. Okay? So that is what is hypoxemia, is when you have low blood oxygen. When you have low oxygen in your blood. Okay? When you have low oxygen in your blood. So try as much as you can to make sure that anytime, anywhere you are, and you are experiencing shortness of breath, okay, just make sure you seek medical attention. Make sure you seek medical attention uh, to solve that problem. Okay, so uh, let's go to the next. Um, Let me expatiate more on this hypoxemia. I've had an incident on this before with a patient. Okay, the sight was not pleasant to see somebody having hypoxemia. Okay, so hypoxemia, it is very, very fatal, very, very fatal and potent if not treated. If you do not report yourself to the nearest clinic to be checked out why you are losing oxygen and you're having shortness of breath. So anytime you're experiencing this, please make sure you check in to the hospital. So anytime you're experiencing this situation, make sure you check into yourself to the hospital to be checked out. It is not good to have shortness of breath. Okay? All right. So, and I've said to you guys, your heart is not here. Your heart is not at the middle. Your heart is not at the right hand side here. Your heart is at the left hand side of your chest. That is the position of your heart. So anytime you are having a pain, any kind of pain on the left side of your chest here, please report yourself to the hospital to be checked out. And that is why most of the time, if you are having a chest pain, doctors want to know the position of your chest pain. They want to know the particular area where you're experiencing a chest pain. If your chest pain is at the right-hand side, it is less consigning. They will attend to you. If it's at the middle, fine. But once you say your chest pain is at the left-hand side here, then it's going to be taken seriously to check out why you are having a chest pain at your left-hand side. That could be a symptom of what to come. So the early you caught that situation and treat it, the better for you. All right. So once again, I thank you guys for watching my channel. Please do not forget to like, comment, share, and subscribe to my channel. Okay, I like reading from you guys. Leave me a comment, and I'm going to respond back. If you guys have any question to this particular video, please send in your question, and I'm going to respond back. All right, I love you guys. Thank you. And once again, do not forget to give me a thumbs up, comment, share, and subscribe to my channel if you have not done so. And I'm going to see you guys in my next video. Stay blessed and goodbye.